Hi there. I'm Daric Mueller, PA from Shores Rheumatology in St. Clair Shores, Michigan, on behalf of RheumNow.com. Today, I'll be talking to you about the creation of advanced practice providers. This includes physician assistants as well as nurse practitioners. So, our story begins in the post-World War II era. Around this time, medical sciences exploded. Advances in drug development and surgical therapies are rapidly evolving around this time. And this really heralds a shift in medicine towards specialization and subspecialization with less emphasis on the generalist and general internal medicine. Due to rising healthcare costs, insurance is a pretty typical benefit offered by employers. And then the passage of Medicare and Medicaid amendments in 1965 creates an environment where there becomes more patients than physicians. And this is especially true in areas of the country with poor populations or rural communities. So out of this chasm emerged PAs and NPs. So how did this all pan out? Again, we're in the 1960s at this point in time in the story. Um, so around this time in the Vietnam War era, we have a plethora of medically trained military servicemen and servicewomen who are coming out of their service period and looking to transition their healthcare experience into civilian life. So one pioneer who looked at this situation, seeing the shortage of providers there to pick up the slack and seeing these servicemen and women fresh out of fresh out of their service and ready to care for people. Dr. Eugene Stead was an internist. He developed the first PA program at Duke University in 1965, and this group was a mixture of four men, all of which were naval corpsmen. If you're not familiar with that, these are medics in the Navy that provide medical services to the Navy and the U.S. Marines. And his vision of this PA program was to train a train generalist medical providers who would work in a collaborative agreement with physicians in order to expand healthcare across our country. So this first class of PA school graduates graduated on August 6th, 1967, and around this week every year is recognized as National PA Week, the week that October 6th through 12th lies on every year. So around the same time out west, the nurse practitioner role was being developed. The first program was created by Loretta Ford and Dr. Henry Silver, a pediatrician out west at the University of Colorado. And essentially, what their vision was in a similar fashion, trying to fill these gaps that were being created out of the expansion of medical science and healthcare, and really trying to capitalize on the successes that public health nurses had in the last 50 to 60 years fighting the scourge of infectious diseases that had ravaged the country for decades before, such as tuberculosis. Uh, so really, this is where PAs and NPs had their birth, and from the 60s, 70s on, we've seen a massive explosion of these healthcare providers working in general medicine as well as specialized fields such as rheumatology, of course. At this point in time, there's over 300 accredited PA programs in the United States. Most modern PA programs are now a master's level program. They were originally a bachelor's program decades ago. So typically, this is a 2-year track where there is a intense didactic year of medical science training, and then after that, there's a year of clinical work done akin to the clerkship system in medical school that involves a variety of medical disciplines that PAs are exposed to. There are some expanded programs now that are becoming more common where some PAs may choose to pursue a PhD level of medical science training. And this is typically attracted to people who go on to work at university centers in a teaching role or sometimes a requirement for some corporate level positions in the pharmaceutical industry. Um, And then looking at the NP side, there are over 500 programs in the United States at this time. Um, Nurse practitioner tracks are either of a master's or a doctorate level track. And there's several specialties or areas of study that each NP program may have a focus on, and that includes family medicine, gerontology, pediatrics, as well as psych. So we can see over the last decades, the way that nurse practitioners and PAs were developed, the thought process is still the same. We still have plenty of patients who need care. That includes rural communities, urban communities, those who have lack of access to specialty care, and there really is no truer situation in the world of rheumatology. Um, so that is it for me. Check out more PA and MP focused content on RheumNow.com. Thank you.